Hi, everyone, and welcome to MHCN's December edition of Peak Speaks, open dialogue within the Australian mental health sector. Before we begin, I would like to acknowledge the Aboriginal and Torres Strait Islander people who are the traditional custodians of the many lands we're meeting on today, and to pay respect to their elders past, present, and emerging, and to recognise the strength and resilience of the Aboriginal people of this land. I would also like to acknowledge people with experience of mental illness and recovery and their families and carers who love and support them. My name is Jade. I'm the engagement coordinator here at MHCN, and today I'm dialing in from Gadigal land. If you're not familiar with MHCN, we are the peak body for mental health carers in New South Wales. We engage in systemic advocacy to reflect the voices and needs of carers and drive change in the mental health system. In this episode, we will be discussing the core principles of open dialogue and exploring the systemic factors that support this recovery approach within Australia. And I'm very excited to introduce our guest speakers today from the Open Dialogue Centre, Shubhangi Kaushik and Mark Hoffenbeck. Shubhangi is Head of Partnerships and Programs at the Open Dialogue Centre, which was established to enable experts from different fields to work together with individuals and families by adapting the principles of open dialogue. Shubhangi is also a registered psychologist with extensive experience working across various verticals of the government and non-government mental health sectors in Australia and New Zealand. Mark Hoffenbeck has been involved in the world of open dialogue internationally for the last 20 years as a trainer and a researcher. He's also the co-investigator for the largest randomized controlled trial into open dialogue currently underway in the NHS. Earlier this year, Mark moved to Melbourne and has been working closely with the Open Dialogue Centre with promoting open dialogue across Australia. Welcome, Shubhangi and Mark. Thank you for taking the time to speak with me today. I think we should just get started. So, open dialogue is a network-based approach to psychiatric care that was first developed in the 1980s in Finland. Since its origin, how has the delivery of open dialogue evolved, and when did this approach first reach the Australian mental health sector?
Mark, did you want to start off with maybe talking a little bit about the origins and the history, and then perhaps we can use that to talk a bit more about the Australian context?
Yeah, thanks, Shubhangi, and thank you, Jade, for having us. It's wonderful to be here and talk about open dialogue. It's become a growing movement across the world, and so it's wonderful to see the Open Dialogue Centre supporting the implementation of open dialogue in Australia. I think the easiest way is to see open dialogue as a natural evolution of the mental health care system, as a social movement, in large part ensuring that the person's human rights are taken into consideration when they're experiencing an emotional crisis. Part of that is involving them in every decision that is made. So open dialogue has continually tried to develop ways to be as transparent as possible, not only with the person experiencing crisis, but also with the carers and the families of that person. So developing means and ways of being inclusive, of making sure everyone's voices are heard. One of the ways we're doing that is including peers to a greater extent. Peers weren't initially a part of the open dialogue approach. The past 10 years in the UK, we've been developing the peer-supported open dialogue approach. So not only persons with lived experience of mental health crises, but also carers and family members are actively involved in the delivery of the service. And I think that's been a really important part of the development of open dialogue. We're also much more trauma informed. I think a lot of the research during the past 30 years, and so since the start of Open Dialogue has created a culture shift within mental health care. And we've really tried to practice the ethos of don't ask me what's wrong with me, ask me what's happened to me. And so involving everyone's voices and creating stories and narratives which help people deal with the issues that very, very often are not their fault, but they've grown up in situations that have been difficult. There is a lot of marginalization, discrimination, stigma associated with a variety of issues, and so helping people deal with those everyday existential challenges of getting on, I think is important.
Mark, Shubhangi, did you want to add on to that one?
Yeah, look, I think talking about open dialogue in the Australian context, when you think about the original Finnish context, open dialogue was very much acute mental health care, and if you Google open dialogue, that is the world that you come across. Things have looked a little different in Australia, and it has slowly been making its way into Australian practice in the past 10 years or so, and primarily supported by the vision of lived experience. Open dialogue was originally one of the key reasons that was brought to Australia was due to the vision of a father who had actually had a really, really horrible experience of engaging with the mental health system in Australia. And through that experience, said, actually, I want to support services and doing things differently and make sure that other people don't have this experience. And I think that's a really, really important history to talk about in terms of open dialogue in the Australian context. So in about 2015, it was a collaboration with St. Vincent's Hospital and University of Sydney, and a lot of work went on in terms of training teams across New South Wales and Victoria. And I think the Open Dialogue Centre itself hasn't existed for very long. We're probably about 2 years since we've existed, but one of the biggest learnings for us has been that training itself isn't enough in terms of leading to a change in practice. And so one of the key things that we do is thinking about how do we support that larger organisational and cultural change. But also the other thing that we are learning in the Australian context, and maybe we'll touch on this a little bit more further in our conversation, is thinking about how open dialogue can actually bring value in some of those early intervention prevention settings. So not just acute mental health care, but thinking about how do we support services to get in early and think about well-being as opposed to illness and, not really being that ambulance at the bottom of that cliff. And I think that's how it's evolved. And some of that has happened internationally as well, but I think Australia is a leader in terms of the different contexts that we are introducing open dialogue in.
Yeah, thank you. And as this approach comprises both a way of organising a treatment system and a form of therapeutic conversation, otherwise known as dialogic practice, what would be the key principles of open dialogue?
If I can start, I think as I said, really have a principle of human rights protection, and part of that is just being super user led. Open dialogue was developed from a needs adapted approach, and so continually thinking about, are we really providing services that are meeting the needs of the person in crisis and their family and network? And very often that doesn't happen. Very often services are based on the professional needs, the organizational needs, the financial needs, and it's really returning to a form of service that if we were in crisis, what would we want? So we talk about a radically client-driven or radically person-driven form of service that's continually asking, what do you need right now? And it's not about symptom alleviation or about medical treatment. If you need help paying your bills, if you need a house over your head, if you need your cat to be fed, That's what we do. And we know those issues are significant factors in a person's well-being. And so we're very open and client-driven, network-driven, and also collaborative. Unfortunately, the people we're trying to support often have contact with multiple services. There's not a lot of continuity. They're meeting a lot of different people. And so we're trying to bring everyone together at the same place, at the same time, to talk about whatever the person in crisis would like to talk about. And so that idea of collaboration and cooperation, I think, is one of the main principles. And when we do that in an open and transparent manner, a lot of positive recovery can happen. Shubhangi, you want to add to that?
Yeah, look, I think when I think about the key principles of open dialogue, and if you do look up open dialogue, you come across those 7 key principles that were developed in Finland, and that's very much what open dialogue is. But I think in our experience in Australia, we've realized that not all 7 of those principles make sense to every context that is utilizing open dialogue. And an example of that is in a school setting. We do have a school in New South Wales that's using open dialogue, and not all 7 of those principles make sense. But I think at its core, open dialogue is really about being with people in distress. And I think it's what we've been asked for by the lived experience movement for like decades. It's really around practitioners thinking about how they let go of that expert opinion, and it's about transparency. It's about how we bring people together, and a lot of what Mark talked about, that collaboration is a big thing of, as a practitioner, how do I let go of my own agenda or what I think might be going on for this person and their family, and instead actually empower this network to find solutions and heal in a way together. So, thinking about those principles and how I said that, I don't think they're relevant to every single context that uses open dialogue or dialogical practices. So the Open Dialogue Centre has identified 4 values, and these values came out of our study tour, and we realized actually when you think about open dialogue and some of those principles, there's 4 values that are actually at the foundation of working this way in a very genuinely human-centered way. And the first value that we came up with was nothing about me without me. And I think that's something that we've talked about for a long time now, but I don't think many services actually really do this well. But thinking about that value and thinking about that in terms of how we work with the people that come across our services, how do we involve them in absolutely every single decision about them? Not making sure that we're not going away or making decisions, having MDT meetings or doing case reviews, but really every single conversation about that person respects their right to actually be involved in that conversation. The second value that we came up with, a social network, was a social network perspective, and this is very similar to one of the principles of open dialogue, where it really is this recognition that mental distress does not exist in isolation. When one person is impacted, there is a ripple effect on absolutely everyone in their social network. So really thinking about how do we think about distress from a social network perspective, and how do we, instead of focusing on fixing this one individual, how do we support a whole network? The third value that we came up with was hope for and a commitment to supporting recovery. And this really was around, this really was around recognizing that recovery was possible for people, regardless of what symptoms they're experiencing or whatever was going on for them. But really being quite committed to supporting that from a practitioner perspective, from a service perspective, and not thinking, oh, this person's gonna come in and out of the door often, they're going to be on medication for the rest of their life, which is something that I've heard a lot of people be told by practitioners, but really believing that recovery was possible for people. Even thinking about recovery quite broadly, was important. And the last value that we actually realized that was at the foundation of working in a truly human-centered way was having care and compassion for the workforce. And this was really recognizing that how well staff were, the workforce was, had a direct impact on how well they supported people that they came across. And so we realized that, you know, for a service that really stays true to these 4 values, and thinks about these values not just from we work with clients in this way, but we support our workforce and we think about well-being, we think about burnout. They were pretty far along in working in a very human-centered way. And so I think thinking about those values as well, in addition to some of those principles of open dialogue, is quite valuable when thinking about how do we work in this way, and how do we support people in a very human-centered way.
Yeah, and since you've both mentioned the collaborativeness of the approach, so since the development of open dialogue, what have been the key delivery outcomes found, and how has this impacted more traditional treatment processes?
Yeah, I wish I could say more. As you mentioned, we have the Odessi trial currently coming to an end within the next 6 months. We hope to publish our findings. What we're hoping to find, and what earlier research has shown, is the most important thing is that we just have better recovery rates. Again, it's related to that everyone can recover. In the UK, if you experience a psychotic break, only about 10% of the people experiencing that will, within the next 3 years, go back into work or education. Whereas in Finland, those numbers are around 70%. And so those are the kind of numbers we're hoping to get out of the Odessi trial, to really document that this is just a better way of organizing and delivering mental health care. And part of that is that if we realize not only the individual, but their social network is not the problem, but the solution, that there are resources within the community and the family and the social network. And so our research is showing that families and carers feel much more heard. They feel respected, they feel empowered, and that changes the dynamics of the mental health care system. So what open dialogue does is it focuses equally on supporting the supporters and helping the helpers. That's a very sustainable way of creating change and recovery. And when that does, in the next instance, is reduces the reliance we have on the medical system. And that's not only services, but there's a decrease in the use of medication. And so people develop their own resources, and so they're able much better to kind of navigate their own recovery. And of course, involving peers and care peers in that process is really important. But there are also just these clinical outcomes. We're reducing forced treatment, we're reducing hospitalization, again, reducing both the amount and the length of medication. So, you know, during the past 30 years, we have seen some really positive outcomes, and we hope that within the next 6 months to a year, we'll be able to publish even more of those results from the Odessi trial.
In terms of outcomes that we have seen internationally, I think they have been pretty outstanding. And you know, I really do think that in 20 years from now, we're going to be looking at looking back, and we're going to be saying, what do you mean you needed research to actually prove that working this way made a significant difference to people's recovery? And you know, there has been some gaps in research, but I think in general, the themes that have come across research internationally, and Mark touched on some of these, have shown that open dialogue can lead to a reduction in hospitalization, in medication. You see people stay engaged in work and study long term. You see an improvement in relationships within families, but also I think an improvement in relationships between people that use services in the workforce. You see, and Mark touched on this again, you see a reduction in adverse events. and just generally an improved satisfaction with services. I think one of the key things that we found when we went on a study tour last year, and this actually hasn't been researched too much, but I think is a really, really important finding for Australia, is that open dialogue. And this we found through a lot of conversations with staff that were working with open dialogue. They noted an improvement in their own well-being and satisfaction with just turning up to work. And I think that's a huge, huge finding, because we do know that mental health staff at the moment, there is a lot of burnout. We are struggling with retention, but a lot of staff talked about how open dialogue allowed them to go back to working in a way that they've always wanted to. The values just really resonated with them, and really shifting away from doing to instead of doing with. And I think that's pretty big in terms of outcomes, and something that we should be quite mindful of in Australia.
And I know that open dialogue is a relatively new approach within Australia, but what's the current status in terms of accessibility?
So look, I think in terms of accessibility, open dialogue has slowly been making its way into Australian practice since 2015. Although there are some gaps still, there are some pockets of teams across New South Wales and Victoria that are really embracing this way of working. And I think one of the key reasons that it has been slow is because it's not something that you can very quickly just pick up and implement. You know, it takes time to really embed this way of working. And you know, one of the things that we did recognize that in terms of accessibility, and I think that's why the Open Dialogue Centre exists, because we realize that there is complexity in implementing it. But talking a little bit about where it's happening right now, and it's primarily in New South Wales and Victoria, and we've got a team in Townsville that use open dialogue. It's being used in early psychosis teams, eating disorder teams. We've been having a few conversations with Head to Health services across New South Wales, and similar services in Victoria with locals. We have been working with a school in New South Wales, as I mentioned earlier, which is a pretty big thing. The school has been using open dialogue for over 5 years now, and they've got to a point where they're starting to have network meetings, not just when there's something to come together and talk about, but it's just something they do. So currently every year 7 experiences a network meeting, and the whole idea is, how do we have conversations? How do we think about prevention? How do we think about early intervention? And then we are having some conversations. We are doing some work with a few headspace providers as well, and youth complex mental health services in New South Wales too. In the Victorian context, we are working with an inpatient unit, but also with the Royal Commission that they've had in Victoria. There's a big recognition that open dialogue actually does have the potential to deliver on many of those recommendations that came out of the report. So there's a lot of interest in Victoria, we're finding, yeah, we've got a few early psychosis teams in Townsville that are using open dialogue as well. So still, in terms of accessibility, I think we still have a long way to go. It's something that's quite difficult to implement in private practice because it is a team-based approach. So at the moment, it very much is, if you happen to live in an area where your local team, your local services using open dialogue, then that's great. But yeah, we're really hopeful that in 10 years, we can very confidently say we've got a significant amount of services that are using open dialogue. Is there anything you wanted to add to that, Mark?
No, I think that pretty much covers it. My experience the past 25 years is it is it's a slow growth process. It's cultural change. But yeah, it's also a social movement, and and in that sense, it does. Again, I started out teaching open dialogue in Norway, and it became very much a part of the consumer and survivor movement, where change was demanded, and open dialogue was one of those changes that both service users and their networks demanded, and that's what it takes sometimes to create real change.
Yeah, I mean, it seems like there's a lot happening in the background, so that's really encouraging that there is things happening in Australia. There might just not be anything immediate at the moment. But the basic vehicle of open dialogue is its radically altered version of the treatment meeting, which typically happens within the first 24 hours of the initial call to the crisis service. So how do you think Australian services can utilize this approach for early prevention, intervention, as well as for acute care as well?
Look, I think we've already got a few services that are really starting to think about that. Some of the context that I spoke about with the school, with Head to Health services, I think they definitely operate in that early intervention, even prevention space. I think for us, it's really around how we support services and shifting from thinking about being that ambulance at that bottom of the cliff to really getting in early. So, for example, in the Finnish context, and Mark, correct me if I'm wrong, is I understand that a large chunk of the population have experienced a network meeting. So it's not just something that you think about. You don't just have a network meeting when there's a problem to fix or someone ends up needing support in a crisis. It's just something that you think about offering early on, and it's something that really just promotes conversation, thinks about well-being. I think fundamentally it's about people having an active voice, having their human rights upheld. And I think when we think about mental distress, I'm all for thinking about how do we actually support people and getting it right early on. So especially in school context, we're really starting to think about how do we promote open dialogue in those contexts, because if we can get it right early on for young people, we might not have these young people ending up in our system needing support in crisis further, 10, 20 years down the track. I think there's also some benefits of open dialogue in a regional, rural context where access is a bit trickier. And we've currently got we're having conversations in Shepparton up in Victoria with a group of services actually that are thinking about what does a community-wide approach look like, where focus is on prevention and supporting well-being right from the get-go, as opposed to supporting people when they turn up to services in crisis. Yeah. Mark, anything to add to that?
I guess there's two things that we often meet. Again, open dialogue is both this way of practicing mental health care, but also organizing mental health care. So there's this duality to it that you need a cultural change. Unfortunately, there's some wonderful, beautiful people working in the system, and the system often corrupts them. I mean, the system as it exists around the world is really not conducive to a very human rights, humane, compassionate way of delivering healthcare. And new public management, lack of funding, lack of time. People are literally running from client to client, and so we need to kind of take a step back and see how we can reorganize mental health care services. And I think what's happening in Victoria now with the Royal Commission is a window of opportunity, and a lot of positive suggestions have been made. And I think there's a really good fit between open dialogue and the transformation that the Royal Commission has needed. And a lot of those things require training to help us sustain that kind of culture. And so that's why the open dialogue is doing such wonderful work on delivering a multiple, suite of different kind of training, so that as many services as possible can get a little bit of this, but we also need a change in the way mental health care is delivered. If you experience a crisis, you're meeting all kinds of people. There's no real psychological continuity, and that's one of the things we emphasize. If we think that trust is important, that human relationships are important, that meeting the same team and telling the same stories and developing that narrative, and just creating caring, compassionate relationships, if those things are important, then we can't send people in crisis from one team to another team every 6 weeks. And so when the work we've done in the UK has been changing the system so that we do have psychological continuity, so that if you do have a crisis 6 months down the road or a year down the road, you can come back to the same team that knows you, that cares deeply about you, and can support you more or less as a part of your own social network. We like to think of open dialogue as really becoming part of that person's social network and being able to support them on a long-term basis. So I think that the real challenge is both changing the culture of mental health care, very much in accordance and in a direction that the Royal Commission has described, but it also looking at how we can reorganize services so that they can deliver open dialogue, and that's a greater challenge, and that's unfortunately not going to happen by itself. I think this is a call to change, and it's wonderful that your organization, Jade, and carers and families and networks can be part of this movement to say enough is enough. We need to change the system so that it operates on the needs of individuals and families rather than just based on professional practice.
And are there any challenges or limitations that are unique to the open dialogue approach? And if so, do you know how service providers and families can kind of combat these barriers?
I do think I think some of that Mark has touched on. I think one of the biggest challenge is to really work this way. You require a whole of organizational culture change. You need leadership on board. You need the frontline staff on board. You need everyone in between on board. And that change process is never easy. It really can take time to bring people on board to think about, well, actually, why do we want to shift? There's also, for a lot of practitioners that have trained and worked in a specific way for decades, there's a lot of unlearning that needs to happen as well. If I think about myself, for example, I was trained to come in and, have a hypothesis, have an agenda, try and assess what I think could be going on for people, but to unlearn some of that and to actually come in with a clean mind and sort of, blank sort of slate to say, actually, no, I'm just going to come into this situation as a practitioner. And my role is not to assess, not to diagnose, not to formulate, but to really encourage dialogue within this network. There's a lot of unlearning that needs to happen there because a lot of it is just habit. I think the other thing in terms of thinking about that organizational culture shift, especially in the context of mental health services, I think there's a lot of fear-based practices that go on within mental health services. A lot of risk assessment, which we have no evidence can be beneficial. Risk assessment processes, the fear of what might happen. It does lead to clinicians working in a more restrictive way or being more risk averse. And I think that's not conducive to recovery. We are really, I think Open Dialogue Centre itself, this is a first international effort to actually think about how do we not just train, how do we support implementation, how do we support culture change on a wide level. So we are really hopeful that will change in a few years, 5 to 10 years. But I think when thinking about some of the ways that families and carers might also just even overcome or even service providers may combat some of these barriers. I think there's really thinking about how families can role model some of these values and principles. Thinking about how do you tolerate uncertainty as a family member or carer, being willing to make space for some of those difficult conversations, not going on with agendas, and I'm often reminded of this one example that one of our trainers talks about. He talks about how he sat in a network meeting with an individual and their family that were in crisis, and it was a 90-hour long network meeting. The family left, they went to the car, got into the car, and then they sat in the car for 3 hours and continued that conversation. And it wasn't actually what happened within that network meeting that was gold. It was that role modeling of a different way of communicating, of engaging in dialogue. And those are all skills that families can actually take away. I think there's so much gold in that. And even in the school setting, for example, we've heard parents talk about how this different way of engaging has completely changed the way their 16-year-old or their 15-year-old engages with them. So I think there's some of those little things that we can do as individuals. And I think open dialogue, not just thinking about it in terms of a professional context, but I think the values and philosophy that is at the foundation of this way of working, it can really teach us some invaluable skills that change how we engage in dialogue in our personal lives. And I think that's something that a lot of families and carers can take with them, whether or not their local services using open dialogue.
Yeah, thanks, Shubhangi. I think one of the reasons I really appreciate open dialogue is it really seems beneficial from the micro level to the macro level. There's so much individually we can do in our relationships, but it's also what we can do as a collective. Carolyn Athnev, who developed social network therapy, was a First Nations member of the Dakota Nation in the United States working on reservations. And she says, what we really need is a retribalization. And what she meant by that was really, we just need to come together as a community. Whether that's a small community centered around a family and a network, or it's a town or a state or a nation or globally. What we're really missing, I think, in today's world from an individual perspective to a global perspective is that sense of collectivity. And part of that means that we need to come together and create real change. And so what happened in Norway is the National Association for Carers and Families of Psychiatric Patients became the most important lobbying group for change within mental health care, because they have a voice that very few other people have. The lived experience, the firsthand knowledge of where the services are lacking, of why they're not functioning, and so your organization, I think, can be, a key factor in creating change. And so that idea of thinking as mental health care is partly research based, but there's so much politics involved. And so to counteract those politics, sometimes we have to become political. We have to organize. We have to be advocates. We have to think about, so how can we lobby? Who do we need to get around the table and say we really need to create this change? And I think that's what is wonderful in working with Open Dialogue Center, is bringing all these voices together that want to create change and saying, how can we support each other to create positive change on the ground so that people in crisis get the help and support that they need and that they have a right to. And unfortunately, they're not getting it today in many cases. So.
Yeah, and the example of the family that left the meeting and then kind of spoke together, and that was where they found the gold, as you said, Shubhangi. So it kind of leads me to believe that although professionals do need to be involved within the open dialogue approach, people can learn about it themselves and take aspects from it and kind of introduce it into their own lives. Are there any like upcoming events or training opportunities happening at the Open Dialogue Centre if people wanted to kind of learn a little bit more or kind of get a few more resources and learn more skills?
Yeah, so we've always got training that we offer, open workshops. Generally, we do training for organizations, but we think it's really important to continue to have some of those open workshops where just people in the community that are interested can come along. We've got a one-day, it's an online one-day coming up. I think it's on the 26th of February. Is that right, Mark? Yeah?
Yeah.
Yeah, and that's just an opportunity. Anyone that's interested, we touch on the key principles of open dialogue, snapshot of what it is, what it looks like. I think Mark's going to be delivering that himself, and Mark's just an absolutely amazing trainer as well. So more details on our website on that, but again, just keeping an eye on our website because we do announce dates through the year, and we probably will have some other ones that we advertise relatively soon. We've also got a conference that we've got coming up, 26th and 27th of May. For anyone that might be interested in coming along and learning a bit more about open dialogue in the Australian context. And we are running our first 1-year foundation course in open dialogue. The next year will be in Melbourne, but in 2025 we're hoping to launch that in Sydney as well. So yeah, for anyone that's interested, keep an eye on our website or follow us on LinkedIn. But yeah, we're very approachable. Send us an email if you have questions, if you want to have a yarn, if you want to have a talk about open dialogue. We are more than happy to actually have conversations and talk a bit more about this and really promote and just build that little army.
Yeah, and thank you both for speaking with me today, just to kind of discuss open dialogue from a foundational level. I personally think that the collaborative aspect of this certain approach is something that I really admire. And as you've both mentioned before, I think that just kind of coming together from all networks and working as a collective would be beneficial for almost everyone. And I'm really excited to see new initiatives and new training programs being developed as well over time. And I will make sure to include a link of the Open Dialogue Centre website below for anyone that wants to look into the workshops or any of the trainings further or for more information. But thank you to you both.
Thank you for having us.
Yeah, thank you so much. Good luck with your work.
Thank you.